As you can see here, folks, we're going to be dealing with how profitable is the market for medical billing services in 2021 and beyond. And so we're gonna deal with that today. My name is Eric Auger. I am part of research and development here at ABS. Longtime companion with the Phillips family, been with them, done all different types of roles, and I really appreciate everybody being here on the webinar this afternoon. And we're going to lead you through this information on how profitable is the market for medical billing services in 2021 and beyond. Speaking of beyond, ABS has been around for over 27 years, obviously approaching in the next 6 months to be 28 years old, and next 2.5 years away, really knocking that 30-year anniversary. So ABS has been around, and they will be here today, and they'll be here tomorrow, and they'll be here for the next 30 years, I'm sure. Adam Phillips is now the CEO of American Business Systems. He is doing a great job of leadership here at American Business Systems. So no concerns about where this company's going. Adam's been a part of this for, almost since his birth. I'll let Patrick talk about that, how long he and his family have been doing this. But let me share with you about iClaim and EMRX. These are the main focus of the medical billing. Now, I know we're going to be talking about medical billing and some other services today, but folks, we cannot get away from the core business of what American Business Systems offers you in the marketplace to allow you to do medical billing independently for doctors that are in all different types of fields, whether they're PCPs or if they are cardiologists or whatever they may be. Anybody that is billing medical claims, you will be able to do those medical claims, and we'll talk about that a little bit more in detail here in just a moment. We also train you and certify you as a medical revenue manager. Now, you can see here where we're certifying you as a certified medical revenue manager, which expounds it further out than just medical billing, because there are some other services that American Business Services have that allows you to help those doctors increase their medical revenue. So we're going to show you some of that information here this afternoon as we go through this. So a lot of people ask, do I need to be certified before I become part of ABS? There's no reason for you to go get a certification or seek any other certification than the certification that we give you here at ABS to be a medical biller and to the other revenue cycle management sources that we actually do have here. Part of your being a part of American Business Systems, you will also be part of the largest network of medical billers in the United States. There's an organization called MERMA. This is the Medical Revenue Management Association of America. All of the ABS licensees are a part of this, and it's growing every month and almost every week. And this is, again, a place where you will be a part of and be associated with. They're the ones that actually do the certification for you here at American Business Systems. I mentioned to you earlier that there are several different other services besides iClaim and EMRX that we're going to be discussing with you today. And as a matter of fact, we've even upped a little bit from the telehealth to now where it's called virtual care, which means we actually need to update our graphic here. But you'll notice that we're going to be talking about virtual care. We're going to be talking about Audit Guard, CodeWrite, iDocs Now. We're going to be talking about several different of these services here that we're going to be talking with you this afternoon. Let me introduce you to Patrick and Linda, his precious wife. They have grown this business over the last, really over 30 years. Linda was actually started doing medical billing over 30 years ago. And Patrick, along with his family, decided to say, you know what, we're doing fairly well at this. We want to teach this to other folks. And that's what they've been doing with American Business Systems over the last 27 years. Patrick is also the author of several books. He has written several books that we're not even showing you, but these are more towards you improving yourself, and then also some material here that can actually help you gain clientele here with the doctors. And he is also a contributing editor on the board of directors here with BC Magazine, and he is very well sought after on giving out information. And just like today, we're going to seek him out to help us out this afternoon. So Patrick, if you don't mind joining me this afternoon, that would be great. And we're going to get this webinar kicked off here.
Okay, Eric, can you hear me okay?
I can. I appreciate you joining me.
Well, you said you were in a hot spot. You know, physically, you're actually in a hot spot, aren't you? It's like you're out in a car or something, aren't you?
Exactly. Exactly. But that's the way this business can run, though, Patrick. It can be run whether you're at home, whether you're on vacation. We're proving it today. We're running American Business Systems just from anywhere. And since our iClaim software is in the cloud and you don't have to actually have it loaded on anything, it gives you great opportunity to really be anywhere and do it at any time you need to.
So let's get started. I'm excited about this one because a lot of people still wondering how profitable, this kind of business can be. And one of the reasons we certify people through MIRMA as medical revenue managers is because you'll be managing the revenue for doctors in their offices. And that comes from all sorts of places. So let's start with this article here, Eric. You found a great article here that kind of points out to people why this is a great business to at least look into.
You bet. Yeah. And folks, you can see that this is dated March of 2021. It really just came out here just recently, showing the growth of what's called revenue cycle management, which is what we teach you here at American Business Systems. And you can see here that the U.S. revenue management market size was valued at USD 120.7 billion in 2020, and is expected to grow by another 11% from 2021 to 2028. Now, Patrick, a lot of people ask, is this going to last past this year? What are your thoughts, Patrick?
We were saying that back in 1994 when we started this business, Eric, is how long will it be, before all doctors are doing this electronically? They all have some kind of magical little device that lets them do that. Well, we have the devices. They just don't have the time or the know-how or the knowledge or the desire to do their own billing. They'd rather turn this over to somebody else outside their office. And that's why our licensees are finding it very easy to sign doctors up, because the doctors don't want to do their own billing. They want to outsource it. They've just not found anybody that they felt like could really do a good job. And we can show them the differences between what we can do for them and what typical medical billers can do for them. And it's tremendous. So yeah, the growth, any industry, Eric, that is growing from 11.2% in the next 7 years, I say that's a good one to look into at least.
Well, I'm going to put this up here, Patrick. I want to let you talk through this graphic here because a lot of it's still showing some in-house, but you can kind of see that slowing down. But the top bar is the outsourced RCM services, and that's a lot of outsourced billing right there.
Yeah, it's kind of hard to tell from these little bars here that you're seeing, folks, but there are a lot of doctors, of course, who still do their billing in-house. That is your target market. We're going to show you how to identify those doctors in your area, the specialties that you ought to go after, and we'll show you how a lot of those convert over to our system and over to letting you do their billing because of what we can show them. It's all about proof. It's all about educating them, and we have ways of educating them. So as you can see there, 2021, this bar chart right here in the middle says 2021 and shows that there's a great growth in the external RCM apps and software. That's external to the in-house software that's being used. Then the outsourced RCM services, that's what you would be providing to the doctors, is that little, kind of an aqua green color there that's on the top of all those bars. As you can see, proportionally, that's growing as you go through the years. So more and more, that will grow, and that means that our licensees are going to capture this market somewhere in the future. Certainly not in the next 7 years. There's still plenty of market out there. I say, Eric, it might be another 25, 27 years before we see the doctors completely turning to outsource. And that doesn't mean that you wouldn't have market share even then, because our advantages over what's out there now are so tremendous that you can show the differences to the doctors, and that makes them want to switch even from one outsourced source to you. Oh, hey, by the way, I
Absolutely.
see a little note here from Julie. Julie typed in the question box. I can see Mr. Phillips. Thank you, Julie. I don't know if anybody else can see me,
Good.
but at least we know
I
one
can
person
now.
can see me.
Well, I actually see it looks like you're in the mountains and you're somewhere. That's awesome.
You know, we can work from anywhere in this business, right?
That's right. That's right. Well, I wanted to also point out this article here. I know that we shared this back in March as well. Apparently, in March is whenever a lot of people do a lot of analysis. But Patrick, this article here, and if everybody can see at the very bottom of this slide, we've got the references to these. So you can go back and look at that. Which reminds me, we have a handout to the right-hand side. There's a handout that you can go download. And don't forget, over in the question box area, feel free to ask us some questions. But Patrick, why don't you talk a little bit about this article that just, again, talking about the extended growth that RCM is actually going to have here in the future.
Yeah, this was just back in March of this year. And folks, as you can see, this study shows, look at that second paragraph, the back end revenue cycle management market. That's what we're involved in, right? That's expected to witness growth in upcoming years due to factors such as increase in target patient population. I think they're talking about us, Eric. We're the target population, you know, the retirees, which mostly includes patients suffering from cancer, tuberculosis, and cardiovascular diseases. Well, those are the three big ones, right? That's why this will always, Eric, I've always said, as long as there are people getting sick, you know, from anything, and they have to go to the doctor has to get paid by somebody, and somebody has to bill that somebody for them to get paid. That's what we're involved in, revenue management. So anyway, the increase again is there. We just want you guys to see that if you're getting into any business, hey, I don't think I would start a business right now that had to do with movie theaters, maybe not even travel, maybe not even cruise lines. I mean, there's just a lot of things right now that I wouldn't get involved in. But the healthcare industry, folks, is as solid as it gets.
You know, Patrick, and a lot of people probably have some thoughts about, you know, did COVID have anything to do negatively for billing? You want to answer that real quickly?
You know, we thought that might happen because fewer patients would be going in to see the doctors. Well, what happened was that the patients that were going to see the doctors, in spite of the COVID, that had to go see the doctors, of course, got that much more attention, and the doctors started using telehealth, you know, telemedicine to see patients. So they didn't have to see them face to face. And that's what leads us to this slide, which talks about this new service that we're just introducing here recently called virtual care. Eric, tell them what remote patient monitoring has to do with.
You bet. Yeah. Folks, if you see over there in that article to your left, it talks about remote patient monitoring, or RPM. This is, and we're going to talk about this a little bit later in the webinar, because we want to talk about medical billing and beyond. And folks, one thing I can tell you about American business systems is that they've been very great about pivoting whenever there are things that come along in the market that disrupt the market. Well, obviously, a year and a half ago when we had COVID, Patrick, Adam, and the rest of the team really put our heads together and try to say, okay, we've got to do something to help our licensees and our business owners here at ABS. And so we all got into virtual care and put some things together. And obviously we had some people look us up. And so what has come out of this is now that we have a new service called virtual care. You can see the growth that are happening in virtual care by 2025. Again, there's a link down there. So if you go pull that out of the handout, you can look that up a little bit later. But I also want to show you this one. Now, this one just came out. This is dated June the 14th. And this was on 69 News. You can go check this out. This was an actual video, but you can see this is up in Massachusetts, and it actually talks about that. It says there is no secret that the use of telehealth technologies rose dramatically with the onset of COVID-19 pandemic. In efforts to keep patients safe, doctors across the country turned to remote patient monitoring (RPM) to evaluate and monitor patients while keeping them at home. Even before the pandemic, 9 out of 10 healthcare providers indicated they were evaluating or had already invested in remote patient monitoring technologies to better assist their patients. Now, Patrick, these are the types of growth things that we're all looking for. When you've got 9 out of 10 providers looking for something new, let me just say ABS was ahead of the curve on this one. Wouldn't you say, Patrick?
You know, it is amazing, isn't it, Eric? We look at this all the time, the different services that we've come out with over the years, because we offer not just medical billing platform that the licensees can use to bill for doctors, but all sorts of other revenue management services. And we're always seeming to be like 6 months ahead of what the whole thing is going towards. Well, remote patient monitoring is the thing I think that is the future, Eric, for doctors to a great degree, especially for chronically ill people who need to be monitored but don't need to be getting in the car and coming to see the doctor. We can do all that now electronically. That's why this last paragraph says, as America seems to be rounding out of the pandemic, telehealth and RPM are here to stay. So believes the American Medical Association. Well, you don't get any more solid than that, Eric, for the AMA to say this is going to be here for a long time to come.
Yep. And it rounds out. This is a great article. So I hope everybody goes out and downloads and go looks at this article. But it continues on about RPM uses innovative technology tools to gather and track patient data outside standard healthcare settings. Cardiology was one of the first medical specialties to incorporate RPM into standard practice. And this is what's so awesome, Patrick. It says that some studies already show that patients using RPM showed a 50% drop in mortality from arrhythmias and congestive heart failure compared to those receiving standard in-person follow-up. So not only did just let that sink in.
I mean, a 50% drop in mortality from those two things there that are pretty common actually nowadays, compared to those people who came in person to see the doctor.
Yep.
So you have a better chance of lasting longer by not seeing the doctor. That's what this says. And wait till you see the details of this, folks. When you see what this really entails, you'll understand why there's big money in this for the doctors as well as for you. We're going to show that to you and prove it to you here in just a moment. And we'll also show you all the profitability of this entire industry here as we get into the details of the medical billing.
Well, Patrick, we want to talk real quickly about can anybody earn not only a 6-figure income, but a 7-figure income in this industry? And I think we can certainly prove that. But, one thing that you and I have been talking about for years is the New England Journal of Medicine. This quote always talks about the dollars wasted in the doctor's office.
Yes, 24 cents out of every dollar. Now, think about that, Eric. That's 1/4, right? 24 cents. That's about 1/4 of every dollar that comes into a doctor's office is wasted on the administrative and billing expenses. So, folks, if you want to save doctors money, get that billing out of their office and into your hands. That's where we educate doctors to the point where they go, oh, a light bulb goes off. Oh, I can actually save money by outsourcing, getting that burden off of my staff. And look, one of the things we did was run a test survey here, whatever you call this, to find out if that was true. And sure enough, when we compared the cost of in-house billing to a doctor, it came up to about $65,000. You see that at the very bottom of that first column. See that? That's what it costs the doctors to do billing inside their own office based on the numbers that we have here in the chart. Again, download the handout and examine this chart very carefully. Then look at the right-hand column. This is what you would charge the doctor to do the billing. You make $31,000 doing the billing for this one doctor's office. And that's a savings of about $34,000 for that doctor. Why would they keep it inside their own office? They shouldn't.
Patrick, I was talking with a doctor not long ago who their office manager walked out on him, and he was it took him 3 months to find a new office manager to do his billing.
Oh my goodness.
Well, yes, believe me, he was scrambling, trying to make sure that he had someone to do their billing. If he had it outsourced, it wouldn't have mattered. So that's certainly a big deal. That what happens whenever a doctor does in-house billing.
Well,
Patrick, I don't know if you had. Oh, go ahead.
Sorry, I was just going to say that is the problem with having people in your own office. You may think, oh, I have more control over my billing. Well, what if one gets hit by a bus? What if one gets pregnant and has to be out for several weeks or months? I mean, it goes on as to why it's not good to depend on one or even two individuals in your office, because if you lose one of them, your income could go down drastically. When they outsource it, there's no problem. If they're outsourcing it to somebody who's a part of the nation's largest network of medical billing companies, that's us.
Yeah, absolutely. And now, Patrick, I know that you've got a little bit of a video here that I think you might be able to start on your end.
Just a little short 2.5 minute video. I want you to see what Laura herself says about how profitable this business can be. Give us a feel for how you started. First of all, well, let's do this. Let's just begin with where you're at right now. Tell us about your business, how big it is, how many clients you have, how many staff you have, and how much money you're going to send me each month.
I mean, yeah, right. Well, that last question is nothing. But to get into the grind of the day-to-day business, we currently right now are doing the outsourced billing for about 12 practices, and we actually, which is really exciting, have 4 proposals out on the table right now. The one proposal is actually in the final phases of, we're just waiting to kind of get all the contractual things in place and then get started with them. We range anywhere from primary care to, we've got behavioral health clinics, we've got therapy clinics, we've got DME companies, we've got an ortho clinic. We actually do some toxicology and pathology lab for some of our physician offices as well. I mean, so we have a broad spectrum of the different types of clients that we have. Some of them being, very small practices, and other ones being large ones. We, have a clinic that has 13 physicians in it, so it's a big daddy. But then we have, a DME company that, is pretty small. But we now have grown. We have 8 staff members, which is really exciting. But over the last year, we've grown a lot with a lot of our clients, and it's been an exciting year for us. It's even more exciting that 100% of those referrals have been from physicians that we currently do billing for. So once you get out there and once you get started, and once you make a name for yourself and you treat your clients well, it's really exciting when you get a referral, that another physician has given for you, to have another new client. So like I said, it's grown really fast, and it's been really exciting. And people question, all the changes with insurance and things changing, and does that affect you? And no, it doesn't at all. Actually, everybody still needs care, and primary care physicians and all types of practices aren't seeing a dip in their in their clients as well either. It is an investment up front, but it's an investment that thoroughly pays off. Once you start getting your client.
Okay, Eric, I want to just pause here just for a moment to let this sink in for people. What you just heard was an interview with somebody. I interviewed her pre-COVID, okay, so pre-pandemic, might have been the early part of last year or even the latter part of the previous year. And yet they have grown, as you heard. She had, like, I think she said something like 13 practices that they were doing billing for. Well, anyway, let me show you the list. This is from our own records that we have from what they, the system sends to us here at ABS. And I want to show you this, Eric, because I don't know if you've even seen this list, but this is the list of, let's see, that's called preview. Here it is. Yeah. So look at this. This is Laura and Brian, her husband Dean. There it is right there. Hi, darling. Oh, that's my grandson. He just showed up. And and we have all of these different types of clinics that you can see that they're doing the billing for. Look, that goes on for another page. Now I'm showing you this because there's no private data here. Actually, it's just generic. But as you can see, the types of clinics that they have and the number of providers. Look at this number down here, Eric. 169 doctors or providers, they're called, that they're actually doing the billing for. Now, isn't that amazing? I just think that's awesome that they are doing the billing now for that many more people. Eric, are you still there?
I'm here. Yep. I'm just not able to see it, but hopefully everybody else can see what you're showing them.
I'm trying to see if I can switch back to you as the presenter to get back to your slides. Did that do that?
Yep.
Okay.
Yep. I can do that. I can see if I can change presenters and get it back over to me. Let me move this one thing out of the way.
Hey, while you're doing that, let me answer a question here that came in from
Yep.
Daryl. Daryl says, if my company is X and another company is Z, and we both use ABS, are we not competing against each other? We got that question a lot, didn't we, Ari? Especially in the early days.
Absolutely.
What if there's somebody else with ABS in my area doing billing? The fact is, folks, that in any general area like the DFW area, for example, this is a big metroplex here, what, 3.5, 4 million people?
Yeah.
And yet there are several licensees here in this area. We never get any questions about competition because, folks, you don't need to have but a handful of clients. Now I'm showing you the deans here having 169 doctors, but that's because they wanted to build this that big. You don't have to make a good income. We're going to prove that to you here in just a second. You'll see how that with one doctor, and certainly with 3 to 5 doctors, you can make a very nice income without worrying about any competition. There's thousands of doctors out there in any given marketplace, so I don't think you have to worry about that.
That's right. Well, we're going to try to jump through this pretty quickly. We're already at the bottom of the hour, and we only have about 29 more minutes left for everybody. So we'll see what we can do, because we really do have a lot of information we want to give you. So let's go through this income calculator here real quickly, folks, and we're just going to step this through for you so that you can go to our website, find this area where it says income potential, and click on medical billing income calculator. And once you do, that'll give you an option to put in some of your own numbers. Now, we've got numbers already in there. We're talking about one doctor that's seeing about 20 patients a day, open 5 days a week. You're charging 7% of $100. Well, guess what? That comes out to be $7 a claim. So we're going to calculate all that back behind the scenes, and you're going to see that once we do that, it's going to generate just over $36,000 a year. Now, if you understand what that means, that's more than the investment here at ABS. But that brings in just a little over $3,000 a month of income. Now, we're going to show you also, if you're doing that with virtual care, you're going to be doubling that income there very easily. So for those that are trying to think about and try to figure out how can I get my return on my investment, we're going to see that here in the presentation today. So just for those that want to know how we got to that calculation here, it's pretty simple. You know, a doctor sees 20 patients a day. Each one of those are valued at about $100 per patient. Obviously, that's $2,000 a day for the doctor. And then you take that $2,000, you times it by 7%. That's $140 a day for you for, again, Patrick, less than 90 minutes of work a day. So again, kind of let that sink in a little bit. That's a good part-time job to have.
Eric, let's talk about that 7% just for a second, because some people may not realize that that's not set in stone. We don't tell you that. You decide how much you want to charge a doctor. But nationwide, we have found that doctors, pay 6 to 8%, somewhere in that area. So we just took 7. All these numbers, of course, are just rounded estimates, but you can ask your own doctor if these numbers don't ring true. They are right from the actual records of our licensees. So to make $140 for 90 minutes time, that's pretty good for any home-based business.
Absolutely. And then you just take those numbers again and times it out times 52. There's your $36,400 per year per doctor. So again, that's good money. Now, all we're going to do is kick it up from one doctor to five doctors. And Patrick, I think on average, that is about the number that most of our ABS business owners actually have.
Yeah, that's right. Now, the deans, by the way, are not typical. It's kind of like those ads you see that somebody lost 180 pounds in a week. That's not typical. And certainly the deans are not what we're saying are typical. We're just showing you the potential that's in this business, folks. Most of our licensees do have between 5 and 10 doctors. So if with 5 doctors, look what you can make when we hit the submit button on this one. Yeah, that's right. $182,000 a year for servicing just 5 doctors. That's $15,000 a month.
So that's a pretty good income with just 5 doctors. And again, if that's taking about 90 minutes a day, that gets you in just about 6 to 7 hours of work a day. And again, folks, since this is a business that you can do literally anywhere, you could be on vacation, you could be mobile, you can do wherever you want to be, and you don't have to always be at the doctor's office doing the billing.
No, you can work from anywhere, and we've had licensees that I've interviewed on our YouTube channel. You'll hear interviews where I ask people, well, where are you that we're doing this interview? It looks like you're on vacation or something. Some of them are. They're working from a hotel room in Hawaii, for example. As long as you have a Wi-Fi connection, you can run this business and make really good money. By the way, the deans do fall into that 7-figure. They're the ones that told me, Eric, on the phone that they're at the 7-figure revenue. So is this a 6-figure income business or a 7-figure income? It depends on how much time and effort you want to put into it. Now, she also said that they had hired, I think, 8 staff members or something. They have more than that now, but that depends on whether, again, you want to manage that many people. Okay, Eric, sorry, we're getting bogged down here. I know you need to move on.
No, this is good. I think this is very, very good. Larry's actually asking, can you overseas travel and log into the system? You bet. Yeah.
Sure.
Yeah, because Larry, what you're doing, you're actually logging in. He's asking about HIPAA violations or compliancy there. Larry, since you're logging into our system, as soon as you log into our portal, you are in a HIPAA compliant portal. So yeah, you could literally be anywhere in the world.
And
we're showing you some of.
Since none of the data resides on your computer, Larry, nothing about the patients is on your computer. It's in our servers, which are located in various locations in the United States. We have redundant servers out there, right? So if one goes down, the other one kicks on. You never know it. It just automatically switches over to the other one. And all of those servers are backed up nightly. So it is yes, it has to be HIPAA compliant for it to work. Yep.
Well, folks, what we're going to do for the next.
We've been doing this for over 20 years. Yeah.
Yeah. So what we're going to do here, folks, for the next couple of minutes, we're going to take you through not all of these. So that means you're going to need to get back with the person who invited you to the webinar to talk about some of these services outside of iClaim and EMRX. But we're going to share with you a few of these other multiple streams. And Patrick, again, we don't go into a lot of detail, but I'm going to let you talk about Quick Collect. And really, what is this? Is this a collection agency that we're turning patients over to?
Well, if that were the case, I would not be in this business because I hate collection agencies. But it can replace one. This actually automatically collects the past due accounts from the patients that owe money to the doctor. You know, there are patients who are self-pay, they don't have insurance, or even the portion that insurance doesn't pay, the doctor bills them for it and they, throw it in the trash or whatever they do when they get the bill. This is 3 times as effective as a collection agency, and yet we never make a phone call. We never send a letter ourselves to any patient. It's all done through electronic, again, cloud-based systems. So again, ask for details about this and you'll learn why this one can be very profitable for you and the doctor.
Absolutely. We're going to look at AutoCard. Now, Patrick, what is AutoCard and how does that apply to the medical field?
This is hard to wrap your head around in today's digital world because everybody's used to email and digital stuff. When we actually use printed, yes, full color postcards and greeting cards that are sent out to the patients to remind them to come in. So you can boost a doctor's revenue by helping him to see more patients on a more regular basis. This system does that automatically. And of course, our licensees use this, Eric, as you know. It works for them to follow up with their prospective doctors. Once they've talked to one, they put them on this and they automatically get a follow-up every month in the mail. Very effective. And many, many licensees have said, this is what made my business grow so fast.
And iDoc Now, is this a different type of electronic medical record? What is this here, Patrick?
Yeah, we have an electronic medical record system, of course, that our licensees can use. That all new documents can be scanned into it and attached to their records electronically. There are many, many records that are in the doctor's office, as you can see from that picture there. You've seen those shelves full of these file folders. That's old data, but it has to be kept for up to 7 years. And doctors are spending a lot of money just, misfiling that stuff, filing it, finding, trying to locate it. And of course, sometimes they lose it completely. Well, this allows you to offer a secure cloud-based storage solution that's 100% HIPAA compliant, unlike Dropbox and some of the other file things that are out there. This one's a true document management system that allows you to search those documents from anywhere in the world, from any device that has an internet connection.
Now, let me share with this to you, folks. Each one of these services, not only that you're helping the doctor, but you're also making a little money on each of these services.
Yeah.
And Patrick, share a little bit about how ABS continues to keep making money and not have to charge business owners a franchise fee.
Well, the reason we have only one licensing fee, an upfront fee of $28,000, folks, that's the lowest investment you're going to find on any franchise that's out there, that's for sure. And we're the only company that I know of that never charges another dime after that. No royalties, nothing whatsoever for support, training, coaching, ongoing webinars. None of that is ever charged to our licensees. Now, with other companies, you got to be careful because they'll tell you, oh, we give you a year's support or 2 years support or whatever. But then after that, it can be another $1,500 a year. We don't charge a dime. The reason is because as a company, we set this up so that we make a few pennies on each of the transactions that go through all of these services that we're showing you here. And we don't have time to go through all of them, but believe me, it's what I call mailbox money. Eric, you set it up and you just go to your mailbox each month and get a check.
You bet. Patrick, why don't you set this little interview up? This is with Beverly Ryder. You did this one a couple of years ago. But it looks down here in her email to you that she received a check for $25,000.
2 minutes.
All right, now I didn't ask you if I could share this email from you, this little note that you sent me, Beverly, but I'm going to throw this up here. I just thought it was a nice little note for you that you sent to me. You remember sending something about one of your clients and you sending an invoice?
I did, and I knew that was the email you were going to bring up, yes.
Yeah, we sent that around the office here. Everybody wanted to see that because Beverly is saying, she actually wrote this to Jordan in our office here. Says one of my clients is receiving an invoice for $25,663.93. That was a nice month for you there, wasn't it?
That really was, yeah. That was very, very nice.
Now, just so people kind of wrap their brains around that of course is not, well, that is the money that you made for the doctor. Is that right?
That is the money that I made, yes.
Yep.
This particular client is a pathology doctor, and the billing that we were doing for her netted her $500,000 a month. And so this is the money that I made, yes. This particular client is a pathology doctor, and the billing that we were doing for her netted her $500,000 a month. And so then I just took my percentage off of that $500,000, and that's what I billed her for our services.
Wow. Wow.
And we mentioned to everybody at the beginning of the webinar about virtual care. Now, we when COVID first started, we were introduced already to telehealth. Now, we already had telehealth in our iClaim platform, but we needed a service that was outside of our iClaim platform because some doctors needed it immediately. And so we were contacted by a company to at least get started in telehealth. Well, that led to where we are today, to virtual care. So it's expanded so much past what people might think of telehealth. So I'm going to share with you a little bit about what's happening in the growth of the market. Again, this is from a gentleman from CMS that says, as it has over the past several decades, healthcare spending is expected to grow on average more rapidly than the rest of the economy. Well, not only is it because that people are getting older and they're needing to go see the doctors more frequently, but it's because of new technology that we're talking about here. Now, what you're seeing here is our flyer for virtual care, and Patrick mentioned to you about AutoCard a while ago. This is one of those AutoCard postcards that are actually sent out on your behalf to your maybe prospective doctors on talking about virtual care. Now, let's look at a couple of articles here. Now, again, these are recent articles as close as March 11th. We already know that there's a thriving boom with telehealth on the digital communication side. We already see down here in that article that the coronavirus pandemic has slowed the momentum and growth for the healthcare industry, but experts say that COVID-19 has brought opportunity for healthcare startups to succeed and innovate. Now, that's you. Patrick, this is remote patient monitoring at its best. It's what I think you found these pictures basically kind of illustrate what this is all about.
Yeah, as you can see, this patient is using her laptop and some other devices that have been provided to her by her doctor that lets the doctor monitor this patient remotely. That's right. You can do all the testing and the things that a doctor would normally do inside the office and now do it electronically. Eric, I proved this myself by a little visit that I had to go to, a little emergency to the hospital. I stayed there for just a few hours, and the doctor, the nurse said, the doctor wants to talk to you. So I expected the doctor to walk in. No, she rolls in this cart with a big monitor on it and a camera on top. And it was the doctor from his home actually visiting with me there in the hospital room. And yes, they took my blood pressure and monitored my heart and did all the things they would normally do, but it was all done through the electronic technology that's available. This is the future, Eric, and no doubt there's a lot of money to be made in this.
That's correct. And we're going to demonstrate a little bit of what can be made, because mostly, folks, here in the beginning, there are two main devices, basically three main devices that doctors are using fairly regularly now. That is an electronic blood pressure cuff that is either gets hooked up to a patient's internet service or through cellular services where they don't need to have a smartphone or anything. Then there is also for diabetes, a glucometer that is also cellular enabled or can be hooked up via the internet. And then a pulse oximeter that shows the oxygen levels in a patient and also their pulse. So you can kind of see some of that illustrated here on that. But let's talk about just on what's called remote patient monitoring and chronic care management utilizing these services. Now, we're just showing you that if the doctors are billing for chronic care management and remote patient monitoring, that could average a doctor $840 per patient annually. Well, let's kind of take that down a little bit to where if he or she had 350 patients that they were monitoring. And again, folks, this is more money than what the doctors are making. They don't have to see these patients in the office. Right. So you can see why a lot of doctors are starting to go, I wonder if I ought to start doing some virtual care. Patrick, with 350 patients, that is almost $300,000 a year in revenue to the doctor.
Yes, and it's almost 100% a net because our technology and our partners, our technology partners, are the ones who actually do this monitoring. They're all, doctors or nurses that are doing this remotely for the doctor's office. And of course, by putting this into our system, the doctor then can see all the results on any patient at any time. And Eric, 350 patients is not a lot of patients. There are doctors who have over 1,000 patients if they've been in practice, any length of time at all.
Yes, I've seen doctors who have, and this is, and let's get it, let's kind of really set the expectation correctly. Obviously, folks, this is for Medicare type patients. So these are patients that are over 65 years old that have either one or two chronic conditions. If someone has high blood pressure and diabetes, those are chronic conditions. It doesn't have to be something that's extremely life-threatening. It could just be those types of conditions.
Right.
But I want to show you, everybody on this call, what you would be making on top of doing any billing. So this is excluding any billing. So if you're helping a doctor with 350 patients, you're making on average about $7 per patient, which is $2,450 per month. This is that mailbox money that Patrick was talking to you about.
Right.
And will bring in nearly $30,000 your first year. Now, Patrick, a lot of people ask, how quickly can I get a doctor on board once I get on board with ABS? What Patrick and Adam have given to you are tools in which is going to get you in front of doctors quicker than any other type of medical revenue management associations that you'll ever be a part of. And you're going to make money on top of that. So Patrick, if a brand new licensee or brand new business owner went out there and found one doctor that could service 350 patients on RPM alone, they would have their return on investment within the first year.
Yeah. Remember, our license fee is $28,000, folks. That is a small investment for any business. But look at this. In 1 year's time, you could get that returned to you without any effort on your part, just by signing the doctor up on this RPM service, and you make another $29,400. So it can be very profitable. We're just showing you one of a dozen different services that you can offer to a doctor. This just happens to be the latest one that we're excited about because, well, let's face it, show me the money, right? There's a lot of money to be made.
That's right. Because Patrick, at the end of the day, you've got not only this, you've got dental billing that the ABS licensees can offer. There's some coding services that the licensees could offer.
Right.
There are just so many different ways to make money at this and gain reputation in the billing marketplace. Because that's really what you want to be able to get to.
Yeah, and Eric, I don't believe in, as you know, in nickel and diming people to death. Once they've paid our license fee, no matter what that license fee is, no matter what year they signed up, all of these new services are available to all of our licensees at no additional cost. That's right. We rolled out dental billing the early part of this year. We did not charge anything to any of our licensees for that. It's a service that they can offer if they want to. It's always optional, of course, because it's your business. You can build this business. And we have licensees who've added other services that we don't even offer, Eric, because it's such a huge market. There's all kinds of things that you can get into. Once you get into the medical market, folks, you'll find that there's dozens and dozens of opportunities out there. And we just love introducing these new ones to people as we have opportunity to do that. And
I'm sure as time goes on in the next 30 years, there'll be more different opportunities as we go forward. Now, Patrick, obviously you try to take the risk factor out of it as best as you can. Tell us about the 100% money back guarantee that you offer.
In today's world, Eric, I can't imagine buying anything myself online that didn't have a money back guarantee. I mean, there's not any other company that I know of in America that offers on a franchise or business opportunity licensing package a 100% money back guarantee, but we do that. And ask your ABS rep more about this. They'll send you our actual agreement that shows this in writing. And folks, yes, if you're wondering, some people have asked for their money back. Less than 0.5% have asked for some money back. I think that says a lot about what we have to offer, Eric.
Yeah, absolutely. Well, Patrick, why don't you take everybody through what you consider the next 6 steps that they could, kind of take some forward steps of some things that they may have done, and then just kind of help them step along and what they can do to, learn more about American business system.
Yeah, so folks, no matter whether this is your first webinar with us or your 100th, we had a lady sign up this week, Eric. Her and her husband have been looking at our business, us, ABS, and the medical industry for over 3 years. So
Wow.
Since we've been around for 27 years, it really doesn't matter how long it takes you to make that decision, but you may have already asked for our downloadable research guide, for example. Now, the reason we have you ask for that is because we only want to work with people who are serious in areas where we do have plenty of opportunity. That guide is a PDF document that has over 50 pages of information about our company, the industry, and our services, and the money that can be made with testimonials from doctors and other licensees. It's a wonderful thing, and you just got to ask for it from one of your ABS reps. Again, that phone number and email address that you see on the screen there will allow you to call and ask who that person is if you're not sure. It's the person who invited you to this webinar. Number 2, browse our YouTube channel. I mentioned that earlier. It's real simple. It's youtube.com. And then you can see that little tiny type there, /YABS. But anyway, there it is. He's showing the actual channel right there. It's got dozens and dozens of testimonials, interviews, and webinars like this one that we've posted out there over the past, Eric? We've been doing the webinars 12 years, something like that.
Yeah, absolutely.
And then be sure and ask for an owner reference list. Now, folks, this is a list of people like Laura and what was the other lady's name? Anyway, like
Beverly.
all these people,
Beverly.
Yeah, Beverly, and like other licensees that you're seeing pictured here on the screen right now. These are licensees who've been through our training. They did their due diligence. They invested the money. They built their company to a certain level, and they'll tell you and answer all the questions that you want. Just ask for that list, and we'll be sure and send that to you as well. Then number 4, ask for a live demo of our claim EMRX platform. Folks, our software does not come on one of these. Yeah. Ooh, that thing kind of disappeared there, didn't it? It's a DVD. We don't put our software on that. We have it on servers that allow you to log in, just like you do when you do your online banking, for example. That software resides on the bank's servers, and I'm sure it's very secure there at a bank as well. So that's what we allow you to do, and that's why we show you a demo with you. That's our person in the upper left-hand corner there, one of our demo people, showing it to you. They can show it to your doctors as well. So we actually help you close the sale with doctors by doing the demos for you and answering all their questions. All right, and number 5 is be sure and ask for the purchase agreement, of course, and the funding instructions. It's a 4-page document. It's not very detailed, but it has everything in there that has to do with our business, and you can get a copy of that, read it over, show it to your CPA, attorney, your friend, relative, brother-in-law, whoever you trust, and let them go over that with you. Then we'll give you the funding instructions to send the funds to us. Once you've done that, you schedule your training. Now, the training is all done virtually, online, but it's done with a real human being. That's right. We pay real instructors to spend hours online with each person individually. So there you and your wife are, our husband there in the bottom left-hand corner. There's our instructor in the upper right-hand corner. And they're actually going through the training materials with you online. We have about 10 modules of what we call our initial training. Each one's about an hour and a half long. And again, you can ask all the questions you want of that instructor. They're yours for that hour and a half. Nobody else is on there unless you invite somebody as a friend. Eric, thanks for putting this together today. I think we timed that pretty good.
So I appreciate everybody being on here and being patient with us. And thank you, Patrick, for being on here with us as well.
You bet. Thanks for coming to the webinar. I hope we see you next week at the webinar, or maybe you sign up for our training and start going through the training. If so, I'll give you a call and we'll chat a little bit about why you decided to do that. Thanks again, Eric. Bye for now.
Absolutely. Bye-bye, everybody.